Dear students, I'll just show a case photo which is quite interesting. So have a differential diagnosis of that and have a look. It will be kept as a short case in the exam. Just see what is this. See that abdominal wall. You can see a scar here, previous laparotomy. Maybe umbilicus somewhere here. Everted edge, pigmented. Must be a proliferate. See the eversion here. See some redness is here. All these are pigmented, but definitely a proliferative lesion. So what are all the possibilities in this condition? So it's a pigmented lesion over the old abdominal scar. Definitely scar is there. You can see the scar here. It may be a recurrent melanoma. It may be pigmented recurrent sarcoma. It may be metastatic deposit from the internal malignancy which might have treated earlier. It's a recurrence. So local recurrence. You can see the everted edge also. Very difficult to give a clinical diagnosis. You should have a differential diagnosis. You may have to go through the previous surgical detail. Must be related to that. Previous GIST surgery, carcinoma surgery, small bowel carcinoma, whatever it is. So might have recurred and come out like this across the abdominal wall. So that is also possible. Or maybe blood spread can cause a scar, secondaries in the scar also, scar deposition. So entire abdomen, other skin areas also, you have to find out whether deposits in the other cutaneous secondaries or deposits elsewhere in the skin in the body. And you have to assess the liver enlargement, ascites, lungs you have to examine, spine you have to examine for the other metastatic deposits. And old documents you have to go through it. Ask the patient to get old document. There may be detail about the operative notes of the previous surgeries, and histology biopsy report may be there. So that will give a very clear clue about the how it is related to that, or it's a separate entity and so on. So all these differential diagnosis, entire proper examination is important. Then do a CCT abdomen and chest. Then take a biopsy from the edge. That will give a clear cut to histologically and origin wise, whether it's related to earlier disease, and eventual planning. Of course, planning is difficult. So entire area is involved, most of the abdomen was involved. When you do a wide excision, if it's local disease, if it's systemic disease, only chemotherapy and maybe radiation as a palliation, not a curative one. Only local disease in wide area has to be removed. Then reconstruction is a difficult thing. What exactly will do? Some special flap you have to do with the help of plastic surgeon after placing a mesh, because you may have to go through because maybe inverted the muscle there, abdominal muscle has to be removed. So if you are able to retain the peritoneum, then you can put a mesh, otherwise biological mesh or dual mesh has to be placed. Then you have to put a flap there and reconstruct it. That's not that easy, technically very demanding. If it is a localized disease only, if it is metastatic, no surgery, only palliative chemotherapy plus or minus radiotherapy. That's the point you have to remember. So all these differential diagnosis just you have to remember. Proper examination important. Groin for lymph node, axilla for lymph node involvement, because it drains, because umbilicus is here. So it will drain both groin and both axilla also. So both inguinal lymph nodes and axillary lymph nodes should be examined in this patient, because the drainage area is both. This is the line watershed area. So both below and up is important. So that is a point you have to remember. So all these things I already told. What all things, tumor markers, biopsy, treatment, everything. So very tricky clinical situation in this patient, just to have idea how exactly these things look like. So go through my SRB's manual of surgery and SRB's clinical method in surgery. Such a things, abdominal wall topic is there. All these typical similar features are there. So you can have the idea how to manage such patient. And also subscribe my website, YouTube channel for daily updated small brief 5 to 8 minutes lectures for your increase your surgical knowledge, understand surgery better with images, X-rays, instruments, brief operative procedures, case scenarios. Mainly important is case scenarios. You'll have a better idea, better understanding of the surgery as such. So again, requesting you to please subscribe my YouTube channel and answer the MCQ. Student, please, I will acknowledge your answer. Total scoring assessing histology in soft tissue sarcoma as per GTNM-G FNCLCC method is. So 6, 8, 10, 12, put the right answer. I'll get the answer later. Main regime contains all these things, A, B, C, D. Again, put the right answer. I'll get the answer later. I'll acknowledge your answer. Please put the right answer so that it increases your knowledge and analytical power. And quotation of the day is, life is a struggle between brain and heart. You will think whether it is, because it is a part of brain is thinking and analyzing. Heart is emotional part. So it is struggle between these two. So it balance between these two always to progress in your life. So there is exact meaning of that. Again, a request to go through go through my manual of surgery and clinical methods in surgery to have a surgery entirely, and also subscribe my YouTube channel for brief lectures and live sessions at regular intervals, detail about long case and other things, case discussions, and brief lectures for case scenarios mainly to have the clear idea to increase your surgical knowledge. So students, please go through my SRB's manual of surgery. It gives a detail about the all CBMA syllabus and covers both for MBBS and postgraduate also. But we got MCQ for each topic wise. General surgery, gastrointestinal surgery, urology, specialty basics, urology, neurosurgery, cardiothoracic, all those basics are covered. Instruments, adjuvant therapy, chemotherapy, briefly about anesthesia, specimens, briefly about anesthesia, briefly operative surgery, and current recent advances also. Everything covered with the quotations, with the illustrations, with the photos. Everything is covered. It's more than sufficient for undergraduate to go through this book, learn surgery, and face exam, face MCQs, everything for both UGs and postgraduates. Also go through my clinical methods in surgery with the video of how to examine in each topic. It gives a detailed examination method, but of course there is no management in this. It is a clinical book, and briefly in a tabular form, differential diagnosis and good photos and exactly how to examine and how to write case sheet of each different topics, ulcer, swelling, breast lump, and everything covered. Briefly orthopedic also. It also has got specimens, images, instruments, which can always be useful when you take Viva and Oxy and practical exam. So very, very useful because you have all videos of how to examine a patient. It's very, very important in your practical exam of any medical graduate of any type. It will be very, very useful. So please go through it and have it. And my operative surgery, the 2-volume book, new edition has come, and it was extensive discussion about the methodology, technical principles, and steps of the different operative surgery, major to minor. Everything is covered with around 10,000 illustrations and photos. And my tissue atlas of tissue approximation, small 100 pages book with the video, how to do suturing in different situations properly with the video. It has shown very well, and can always go through that. And my DigiNow lectures through JP Publishers, around 220 hours, covers everything, A to Z topic, urology, specimens, instruments, clinical examination, videos, everything it is covered. Please, you can purchase for a year so that you will have the clear idea. You can face the exam, have the clear idea, academic part, everything. Will have entire subject is covered, including clinical part. So please purchase and have a clear idea about subject and to face the students. I hope you have understood this lecture very well. Thank you so much.